Okay, well, we appreciate you coming to our Medicare 101 seminar. We're going to go ahead and get started. I'm sure there'll be people that'll be hopping on a little bit late, but we want to respect the time for those of you that are already on and the webinar. The goal of this webinar is to go over the basics of Medicare for those of you that are just getting ready for Medicare. You're 64 or you're a little bit older and you're leaving your group plan. And we're going to go over the basics of Medicare and the different gaps and issues with original Medicare and the ways to fill those gaps. Now, if you're not able to stay for the whole webinar, feel free to fill out the form and click the link below to book your one-to-one where we can go over your situation and find the best plans and solutions to your questions and your needs. We look forward to helping everybody with this transition because we know it can be complicated and confusing, and we do our best to minimize and reduce that complication. So let's go ahead and get started. First, a quick introduction. My name is Eric McShannon. I'm the founder of McShannon Insurance Plus. I'm a married man with a wife. We've been married for 18 years, and we have these two young ladies as our daughters. Our oldest daughter is finishing high school this year and getting ready for college. She's got a couple that she's looking between, and my younger daughter is a freshman in high school right now. My wife has her own career with a corporate company. Before doing health insurance, I worked a couple leadership, management, and educational positions, and so I've done a number of different things that have put me in a place of knowing how to communicate to a group of people and individuals to help them understand. And I'm taking that to the health insurance industry to help you with your transition, because we know it is very confusing and the government does not help with that. All right, and again, I founded McShannon Insurance Plus. We are a 5-star rated company, and we service both locally in our area around DFW, Texas, and nationwide. So wherever you are, we can help you. We have a supportive staff that lets us help our clients year-round with not just the enrollment, but answering questions anytime they come up. Our focus is education first, which means things like this webinar, where we focus on first letting you understand what the parts of Medicare are and help you understand how things work and how they're going to work for you and your situation. After education, then it's service, being there available to answer your questions and fix issues that come out after the enrollment. And so anytime something comes up, our team is there for our clients. All right, we'll just get right into it. Again, we expect this webinar to be about 30 to 40 minutes, and we're going to start with the original Medicare, or what is Medicare, or that you get from the government. All right, so original Medicare, you have Parts A and Part B, and we're going to go over what each of them are and how you get them. All right, there are 3 different scenarios for getting started with Medicare. Now, while you're going through this presentation, and try to figure out which of these is you and focus in on what that means for you. So the first one is the easiest one. That is when you're currently receiving Social Security. The second is for those that aren't yet, and the third is for those that are still working. So if you are retired and you're already taking Social Security benefits, this is the easiest transition, and they will, this government and Social Security and Medicare departments will automatically enroll you in original Medicare, both Parts A and B, and they'll just take the premium for Part B out of your Social Security automatically. For most people in 2026, that Part B premium is going to be $202.90. I say most people because if your income is very low, well, then Medicaid can kick in and help with that cost. If your income is higher, then you may have some IRMA cost adjustments. And when we do your individual meetings, we'll go over the IRMA chart and see if that affects you. All right, scenario 2. This is when you are not yet taking your Social Security and you do want to go ahead and go into Medicare because you don't have another health insurance at that time. All right, so there are a couple different ways to enroll in Original Medicare. Ironically, you don't enroll in Medicare through the Medicare organization. You enroll through Social Security. So you can do it in person at your local Social Security office. You can do it online, and if obviously you've been able to do online enough for this webinar, so that that may be a good option for you. Oh, here's the website here for that. It's the SSA.gov website, and you'll just make a My SSA account if you haven't already, and then from there you go through the process for signing up for Medicare. Now, when you're signing up for Medicare, they'll ask you if you also want to start your Social Security at the same time. So they can word that either direction. Just make sure to read that question carefully and decide if you are ready to take your Social Security or not, and answer appropriately. You can also do it over the phone. Most of our clients, we recommend either doing it in person or online. And if you need help with this process, feel free to reach out and we can give you more guidance on this as well. Now, I forgot on that last part, if you aren't taking Social Security yet, they bill your Medicare Part B premium from Social Security quarterly. So instead of $202, it's going to be $202 times 3. So you get that bill every 3 months. All right, the third way, again, is if you're still working. Now we have to weigh the work insurance versus the Medicare and decide which one's better for you at this time. And if staying on your work insurance is the right option, there are some other gaps that are important to cover when you're going into retirement age that weren't important to cover while you were still working. So either case, we do want to schedule a private meeting to discuss your situation and to figure out, we can weigh the side-by-side of the group insurance versus Medicare, and we can also look at your plan and to see if there's any retirement gaps or 65 and older gaps that we want to cover now versus covering later, because they'll get more expensive the longer you wait to cover those further gaps, and sometimes you may lose the opportunity to cover them if you wait too long. All right, so Original Medicare Part A and Part B. Hey, when do they start? They're going to start on the first day of the month and year that you turn 65. So if you turn 65 in July, if you have a 4th of July or a 13th of July birthday, your Medicare is going to go effect the 1st of July. Now, if your birthday is on the 1st, then your Medicare goes into effect the 1st of the month prior. All right, so that's when your Medicare is going to go into effect. Okay. Now, major exposures when it comes to Medicare. So Part A is the hospital. So this is covering for when you're in a facility. You're going to have the cost deductible for that going into the facility that you're responsible for if you don't have some gap coverage of $1,736 as of 2026. Now, if you stay in the hospital for an extended period of time, that will go up and you'll start having daily occurrences as well. Now, Part B has the bigger gap that we're more worried about. Part B is for covering what happens when you're in the hospital. Now, Part B is pretty simple. It's an 80-20. Now, that means the Medicare covers 80%, and then you're responsible to cover the 20%. Now, that doesn't sound too bad until you realize that's an 80-20 with no maximum. And so that means if you have a $100,000 surgery, you're responsible for $20,000 of that. Now, my family has had a number of very large things, and I can tell you, things can get a lot more expensive than $100,000. You could see $1 million open heart surgery, and then you'd be out $20,000. And sorry, it's $200,000. So if it's $1 million surgery, and even if you can cover that, you'd much rather not have that all coming out at once while you're doing medical. So it's better to have that covered with different insurance gaps. Part B also has a small deductible of $283. We're not too worried about that. We're more worried about covering that 20% and with no limit, and the Part B excess charges, where if a doctor doesn't fully contract with Medicare, then you're responsible for that 15% additional that the doctor can charge above what original Medicare suggests the price be. All right. Now, at this point, you guys have probably already done some research on Medicare already, or you've gotten a lot of mail, a lot of phone calls, and you've seen the TV ads. So you've been hearing the words Medicare Supplement or Gap Plan and the words Medicare Advantage plans. So we're going to go over both of these, make them simpler, kind of explain them, demystify them, and figure out how they each work, and help you kind of figure out what makes sense for you. All right, so on the left, we got the original Medicare going to a supplement, and then on the right, we got the Medicare Advantage. And so both you're going to start by having your original Medicare A and B, and then you're going to get your supplement, and then your standalone drug plan. Now, there are some other ancillaries that you're going to want to get outside of those core medical costs when you go with the supplement. Now, with the Advantage side, your Medicare is combined. Your A and B is covered by Part C or Medicare Advantage. A private company takes over management of your care. That could be one of a number of different carriers that you've heard of. Then you'll have small co-pays and a max out-of-pocket. Prescription drug plans will be included with most of these plans. It'll have built in, and these plans can include some extra benefits like dental, vision, and hearing built in as well. All right, comparing the two. So with both of them, you're going to be responsible for that Part B premium. Again, for most people, that's going to be $202.90 for 2026. The price for Part B premium does go up most years. That's through the government. We don't have any control over what that's going to be. The coverage has the lowest out-of-pocket costs when you're going to the doctors when you're on a supplement plan. I call them prepay. You pay a monthly premium for being on the supplement, and then you've prepaid, and you'll have little out-of-pocket afterwards. Now, network, when you're on a supplement, you can go to anyone that takes original Medicare. This is the most open, most free access to medical services that you'll ever have. With the prescriptions, you'll want to pick a Part D plan. Even if you aren't taking any prescriptions, we want you to pick one up right away. That way you're not penalized for the time you go without, if later you need one if you're not needing it right away. We plug in your prescriptions and figure out the prescription plan that's best based off of your needs. Okay, on the other side we have Medicare Advantage plan, and again you're going to have to pay that Part B premium. you'll have different copays and max out-of-pockets. These are going to work similar to plans you've had before Medicare, or your group health plans or your marketplace health plans, where you're going to have different copays for going to the doctor, having a surgery or procedure done. They're going to have networks, either HMO or PPO networks, and they'll have the prescription drug plan built into them. Again, they can include extra benefits like dental, vision, and gym memberships over the counter. A lot of the commercials will really advertise on this part as the major selling promotion, and trying to get you to come to them, and because they can get you these shiny things. And the shiny things are nice, but we want you to choose your health plan first, extras secondary. Okay, now when we put them side by side, and again you got the Part B premiums on both, you're going to have more freedom on the supplement. You're going to have a little bit lower upfront cost on the Advantage plans, and both are great options, and which one's right for you just comes down to what's most important to you. I've got clients that are healthy that choose to go with Advantage plans, and to save a little bit of money up front, and I've got clients that really like the strength and the doctor access freedom of the supplement, and we can figure out what makes the most sense based off of your feelings and your health history, and we'll go a little bit more over how both plans work. Okay, now no matter which side you go on, be it the Medicare supplement or the Medicare Advantage plan, there are gaps above what's covered by your Medicare and your supplement or Advantage. And we'll go over a couple of those. One of those is cancer, heart attack, and stroke. There can be expenses beyond what's covered by your base coverage, and so we always recommend picking up a cancer policy to help you with those uncovered expenses. One of the largest expenses when it comes to medical, when you're in retirement age, 65 and older, Medicare age, is skilled nursing coverage. And this is one of the least talked about parts of Medicare and medical cost. And original Medicare is going to cover you for days 1 through 20 at no cost. If you're on original Medicare or Advantage plan, you're going to have a copay for days 21 through 100 of about $217 per day. That will add up quite quickly to be a big chunk. And no matter if you're on a supplement or an Advantage plan, and you won't have any skilled nursing coverage past day 100. So this can be one of the largest medical cost risks. And so we definitely want you to be aware of it, and we'll go over different solutions for that as well. All right, this is just an excerpt from the Medicare and You book. It's talking about how skilled nursing care facilities don't go into effect until 3 days after a stay in an inpatient hospital, and some of the expenses that aren't covered by original Medicare or a Medicare supplement. And we just want you to be aware of these different expenses, and then we'll go over how to cover them. All right, so we kind of talked about how there are gaps in your Medicare after the supplement and or the Advantage plan. So we have put together these umbrellas to help cover you and protect you, starting with your core medical and prescription, and then covering those cancer, and recovery care, and if you care about dental or vision, and we'll go over individually what is the right umbrella policy for you and your situation. All right, so again, we got the two different sets of options. Now we'll go a little bit more in depth on the Medicare supplement side. Okay, so again, this is just showing those different gaps of original Medicare. Going into the Medicare supplement options, also called Medicare Gap. These are private company plans, and they help pick up those expenses. All right, so this chart can be a lot to look at, and we'll simplify it and just explain what it's the most important here. These are the different expenses that are left with original Medicare. You got your Part A deductible, your Part B expenses, and your Part B deductible. And you'll see Part B deductible is no longer covered on most of these, but that's that $283. We're not too worried about that. Plan F used to be the major strong coverage, but if you're turning 65 now, you're not going to qualify for Plan F. But good news, Plan G covers everything the same as Plan F, except that Part B deductible. So if you go into the hospital, it's going to cover the Part A deductible. It's going to cover the 20% for Part B, and it's going to cover you very well. And it doesn't matter which carrier you go with. This secondary option is Plan N. You'll see it also covers 100% on most of these things. It has that same gap on Part B deductible, and then a gap on the Part B excess charges. That's where if you're at a doctor that is partially contracted with Medicare instead of fully, where they can charge 15% above what original Medicare deems for a cost, and then you're responsible for that extra cost. If you're in Plan N, you're responsible for it. If you're in Plan G, the plan picks up that cost. Okay, now you're probably wondering, so what does this cost? Unfortunately, when we're doing these large webinars, we can't go over what the cost is going to be for you, but we'll give you a range. They're going to range from $100 to $200 a month for your Plan G supplement. They're going to depend on what zip code you live in, if you qualify for a household discount, and a couple other factors, but we will get you an exact price options for you when we go over your information and directly, but we'll just give you this as a range for now. Okay, so which Medicare supplement is best for you? So the Plan G, like we said, is going to range from $100 to $200. You're going to be responsible for that Part B deductible, and then the plan's going to pick up all the Medicare approved expenses after that. Again, there are some medical expenses that are past what Medicare approves, those like dental, vision, hearing, this limits on skilled nursing, and like I said, there are some cancer expenses that are outside of the scope of Medicare as well. Plan N, the premiums tend to be $20 to $40 cheaper than the Plan G, and you're going to be responsible for that same Part B deductible. Then you're going to have small copays for doctor visits, and again that excess charge for if a doctor is outside of the full contracting with Medicare. Now, that's not very common, but it's still something to be aware of, and those contracts can change over time. Okay, so key points about Medicare supplements. The best time to look at these plan options is about 6 months or so before you're turning 65. We can lock in the rate, let you know what your costs are going to be, and if anything changes on your needs, we can change them down the road, but we can get you set early. We don't have to wait till the last minute. other things to know, these plans are standardized. So that means, like you saw in the chart, all Plan Gs cover everything that was listed there. So how do we choose which Plan G is right for you? If you have a particular carrier you love, we can look at that one, but we tend to look for one that has a long history, has a high rating, and is competitive price-wise. Those things will give us a competitive price now and more likely to hold a competitive price longer term. We look over 20 and more carriers for these supplements to find the best one for you. We look at all the ones that you can see yourself, and we have access to even more with our contracts. Excuse me. All right, so a couple of myths that we hear when it comes to Medicare. Myth one, I must have to pay a fee to work with a broker and get their help with all these things. And that is false. We are not even able to charge you a fee with our contracts and with our licensing with the government. We are paid by the carriers. Okay. Second one, nobody works for free. So the insurance companies must charge a higher price if they go through a broker. This is false. The carriers charge the same rate if you go directly through them or if you work through our company and have access to us as your agent, helping service you through answering questions and being able to come to us whenever you have issues. In fact, we have actually access to some plans that they don't give access to individuals with our contracts. Myth 3, if you get paid by the insurance companies, you must have a bias towards one company or the next. And I understand where that can come from, but honest truth, when it comes to me, when I'm looking at these plans, and the commissions are very similar from one plan to the next, I don't even think about what the commission difference is from one plan to another. I look at your situation and what medications you're taking, what your needs are, what's important to you to help you find what's right for you, and not what's going to get me the higher commission. All right, again, those 3 myths and truths. No fees being charged to work with us. Price you pay with the insurance and company is the same as what you pay when you're working with us. We look at over 25 different companies and plan choices unbiasedly to find you what's right for your needs. All right, prescription drugs is now, we're not going to take a whole long time explaining these. We're going to go through it real quick, and if you have a lot of prescriptions, we'll make sure we take the time to find the right plan for you. All right, so when you're looking at the prescriptions, again, you start with original Medicare, your Medicare supplement, and then the prescription drug plan. And we do want to make sure we get the prescription drug plan right away, even if you're not taking any prescriptions, because you can end up with a penalty for late enrollment for Part B or Part D. So we want to make sure that we take care of them right away so you don't get permanently penalized for late enrollment. All right, our process when it comes to Part D. First, we get a list of your medications. We input your medications into our software, and it does the heavy lifting, honestly. It's going to tell us which companies are going to cost you the least overall through the year when it comes to adding the cost for the plan plus the cost of the copays together. And we'll explain how much it's going to cost you month by month, and breaking down the deductible, the copays, the premium, and explain all that and the different payment options to make it affordable and easy for you. We plug in any pharmacy choices you care about. We compare the options, we go over them, and then help you know how to navigate getting things set up with the plan. And then if you need any help reviewing your plans during annual enrollment period every year, that's October 15th through December 7th, we can do that as well. All right. And again, with the supplement, you're going to pay your original Medicare Part B premium $202.90. You'll get your supplement. The price of that's going to vary by zip code and county. And then the prescription drug plan, and the price is going to vary depending on what your prescriptions are, where you live, but we'll lock that in as well. All right, the second option, and again, is Medicare Advantage plans. So let's go ahead and go over those now. All right, so Medicare Advantage plans are managed care, must include cover everything that original Medicare covers, both Parts A and Part B, and they're going to include the drug plan built in. Plans can be as low as zero premium. Now, when we see zero premium, you don't think zero and done. There are more gaps in Advantage plans than there are in supplements. Excuse me, and both Medicare Advantage and supplements we recommend and getting an umbrella policy, and we always recommend them when it comes to Advantage plans. You're going to have co-pays, deductibles, co-insurances, and the max out of pocket when you go with Advantage plans. All right, so choosing a Medicare Advantage plan, first we plug in your zip code. This will tell us which plans are available in your county. Then we'll plug in any doctors and medications and hospitals that are important to you. So that'll help us focus on the plans that have the doctors that you care about, and we'll know what your cost of your medications are going to be on the plans we're looking at. After we look at doctors, hospitals, and medical costs, then we can talk about the extra benefits like the dental, vision, and gym memberships. And again, I don't like to choose plans based off those things. I consider them more the dessert versus the entree of the Medicare. All right, so how and when to sign up? We do still recommend scheduling a review right away, but we will, if we choose to go with an Advantage plan for you, we can do the enrollment on the Advantage plan up to 3 months before you turn 65. But you don't have to wait till then for us to do our meeting and to go over the options for you. Annual election period, and this is when we review plan changes. This happens every year between October 15th and December 7th. Plans will change every year, copays will change, and what the extra benefits will change, and you do want to keep up with what changes on your plans. And we will help you with understanding the changes when they come, so you're not just left on your own there when you're working with us as your agent. All right, so again, this is the side-by-side Medicare supplements and Medicare Advantage plans. And at this point, you may have already figured out, I know I want to go with that option or that option. And that's perfectly great if you do. If you don't, that's fine. We can help you iron that out as well. Again, and the Medicare supplement side, you're going to have more freedom of doctor choice. You'll have a little bit higher upfront cost, but that cost is going to stay pretty flat and consistent. You're not going to have surprise costs, especially when you have it properly backed with an umbrella policy. And then the Medicare Advantage plan and side, that you're going to have lower upfront costs. You'll have more extra benefits built in, but you're going to have to stay within network, and you'll need need insurance authorizations and things like that. And again, this is just reminding us that we do want to talk about and review your umbrella covering those recovery care, cancer, and other gaps beyond what's covered by your original, your supplement or your Advantage plan. All right, so what we found with years of helping people with their medical, when we're talking with seniors, is you're also going to be transitioning financially. Some of you may already have somebody you're working with, and that's great. But you may want a second opinion, or you may not have somebody you've formerly been working with. You've just had been contributing to your 401k. Well, this is an important time to be reviewing this transition as well. What's going on with your finances when you're getting to this age, if you've left your job or if you haven't left your job yet. So we have put together a team that doesn't charge you, that is an expert at this transition and can help review that. If this is something important to you when you're in your meeting and reviewing your health, make sure to ask to book one of these reviews as well. So things that they look at, they are experts at 401ks, SEPs, Roth IRAs, 403bs. They understand the market-driven accounts like brokerage accounts, mutual funds, individual stocks, and liquid assets as well. We say safe money retirement because as they talk about things that help keep your money from crashing when you're going into retirement. Safe money is about principal protection, still having growth, and income into your retirement age. All right, so now where are we at wrapping up this presentation? You've already gotten in some of our educational content in today's webinar. Hopefully this helped you understand a little bit more about the parts of Medicare and the transitions and the gaps in Medicare, the different solutions for filling those gaps. So the next phase is we want you to schedule your free consultation where we go over your situation. We go in depth on your needs and answer all the questions that come up between this webinar, or you probably got a list of questions that you're like, oh, how does this work though? Oh, write those down, have them saved, and when you book your one-to-one and meeting in free consultation with us, then we can answer all those questions and get you taken care of. Now, we do have a couple free gifts for coming to this personalized Medicare roadmap, cost summary, and we're also going to include a PDF copy of our Medicare book as well. Now, phase 3, if you become one of our clients, we do include lifetime billing and claim services where our team will help answer questions and help with issues as they come along. So thank you again for being on this webinar. The next step to move forward with us helping you is going to be to click the blue calendar below to schedule your free consultation where we can go over your situation, answer all your questions, and put a roadmap together of what needs to be done when, what your costs are going to be it if you go with a supplement or an Advantage plan, and answer all your questions. And we look forward to serving you beyond this educational, and either way, thank you for being on this presentation with us. Have a great day.